Today we're going to talk about the endocrine system. So our endocrine system is going to include multiple glands. It's going to include the pituitary, thyroid, parathyroid, adrenal, pineal, and then it will also include several organs that are not exclusively endocrine, such as the hypothalamus, thalamus, pancreas, ovaries, testes, kidneys, stomach, liver, small intestine, skin, heart, adipose tissue, and placenta. These other organs will actually have little bits of endocrine tissue in them as well. So an exocrine gland is going to secrete its products into ducts. The way I remember it is it has a specific exit, so those products will end up in one particular place. Endocrine glands, on the other hand, are going to secrete their hormones into the interstitial fluid. There's no ducts, so these are going to diffuse into the surrounding tissues. The steroid hormones, these are made from cholesterol. That's going to make them lipid soluble, and they will diffuse easily into cells. So this picture here shows the various different endocrine glands that you get. Just keep in mind, you either get ovaries or testes, but they put them both onto one person for simplicity's sake. So your hypothalamus and pituitary are closely linked in what we refer to as the neuroendocrine system. So your pituitary gland is going to secrete several hormones that are going to control other endocrine glands. So when it controls another endocrine gland, we refer to it as a tropic hormone. So that can really help you when you look at the names of these hormones. Try and let the name give you some hints. So the hypothalamus is the brain link for the nervous system and endocrine system. This is how you can have what is going on in your mental and emotional world affect your physical body. So sometimes they will refer to these things as the hypothalamic pituitary adrenal axis because all of these are so closely interlinked with each other. With our pituitary gland, it's going to have an anterior and posterior lobe. The anterior pituitary is stimulated by releasing hormones, and a lot of times those hormones will actually have releasing hormone in their name, and then suppressed by inhibiting hormones, again having inhibiting hormone in their name, which makes them tropic hormones. The posterior pituitary is going to have axons of neurosecretory cells that are going to extend down from the hypothalamus, so the hormones are actually made in the hypothalamus. So here this illustration shows you having an anterior and posterior pituitary. So some of the hormones are lipid soluble. Your steroid hormones like estrogen, progesterone, cortisol, testosterone, thyroid hormones like T3 and T4 and nitric oxide. And then some are water soluble like your amine hormones that are made from modified amino acids. Your polypeptide protein or glycoprotein hormones, these can be anywhere from 3 to 200 amino acids. And then the eicosanoid hormones like the prostaglandins and leukotrienes that are derived from arachidonic acid. So there will be little bits and pieces of things that are in the notes that I've left in there more as it may be of something of interest to you, but I don't really consider it to be part of our lecture material. So for the sake of keeping it easier for you, I just leave those things out of the video and they're in the notes. So looking at our anterior pituitary hormones, there's 5 types of cells that will produce 7 hormones: somatotrophs, thyrotrophs, gonadotrophs, lactotrophs, and corticotrophs. So the first one is human growth hormone, and we abbreviate it as HGH. So when you see the plus sign on here, it means it's going to stimulate something or be stimulated by, and then I use a negative sign if it's going to inhibit something. So human growth hormone is going to stimulate the synthesis and secretion of the insulin-like growth factors or somatomedins. What these are going to do is promote lean tissue growth, healing, repair, and breakdown of fat. It will increase the glucose to the neurons, so they do affect your blood glucose levels, and they'll actually be regulated by blood glucose levels as well. So it's going to be stimulated by growth hormone releasing hormone, and this will be released when the blood glucose is low, and then inhibited by growth hormone inhibiting hormone when the blood glucose is high. So that's something to keep in mind when you're doing your workouts. If you're looking to maximize the effects of human growth hormone, after a workout, you probably don't want to chase it with a meal that's going to raise your blood glucose really high, because that would shut down some of that human growth hormone. So your insulin-like growth factors, they're called this because they do act similar to insulin. They're going to stimulate protein synthesis. So they'll maintain your bone and muscle mass, and then also break down fat and glycogen. So other things that can influence this would be the fatty acid and amino acid profiles in a meal in the bloodstream, sympathetic stimulation, glucagon, estrogens, insulin, your sleep, the types of fatty acids you have, emotional deprivation, obesity, thyroid hormones, and human growth hormone. So thyroid stimulating hormone, this is going to stimulate the production of the thyroid hormones T3 and T4. It's going to be stimulated by thyrotropin releasing hormone. This is going to come from the hypothalamus, and it's going to work on a negative feedback loop with T3 and T4. So if T3 and T4 are low, it's going to increase TSH. If T3 and 4 are high, it's going to decrease TSH. So follicle stimulating hormone, it's going to stimulate the development of the ovarian follicle, which is the egg in the ovaries, and estrogen production. In a male, it's going to stimulate sperm production in the testes. It's stimulated by gonadotropin releasing hormone, and then it will be inhibited in a negative feedback loop through inhibin. So if the sperm production is building up too much, it will shut it down. Once a female releases an egg, it will shut it down with inhibin so that you don't have multiple eggs released. Luteinizing hormone is going to increase the estrogen levels and lead to ovulation. After you ovulate, that little spot where you ovulated from is going to form the corpus luteum, which will secrete progesterone. In a male, it will increase the testosterone production in the testes. So this is also regulated by gonadotropin releasing hormone. So prolactin, this is going to initiate milk production. However, it has to do it in tissues that have been primed by other hormones. So prolactin by itself is not going to lead to milk production. Prolactin inhibiting hormone, which is chemically the same thing as dopamine, is going to inhibit the release of this most of the time. So your levels of prolactin inhibiting hormone decrease a little bit before the menstrual cycle to increase a little bit of the prolactin releasing hormone, which will contribute to breast tenderness. Prolactin releasing hormone will be released during pregnancy. So hypersecretion of this in males can lead to erectile dysfunction, and then in females, galactorrhea and amenorrhea. ACTH, adrenocorticotropin, this is going to lead to the production and secretion of the glucocorticoids. The primary one is cortisol, which also affects glucose metabolism. So it's stimulated by corticotropin releasing hormone due to physical stresses. So that can be decreased blood glucose, physical trauma, IL-1 from the macrophages, can all lead to it. And it's going to be regulated by negative feedback. Melanocyte stimulating hormone, this will lead to an increase in skin pigmentation from melanin. The levels of this in humans are really low. We see higher levels in amphibians, and we don't fully understand the role of this in the brain. Interestingly enough, it is stimulated by corticotropin releasing hormone, so it's linked to stress, and then inhibited by dopamine. So we know excessive corticotropin releasing hormone can actually darken human skin. So at the posterior pituitary, it's going to store and release hormones from the hypothalamic neurosecretory cells. So oxytocin, this is going to lead to milk ejection. It will lead to smooth muscle contraction in the uterus, and it also fosters emotional bonding of the mother with the child. The synthetic form of it is Pitocin that is used to induce labor. So when a woman is breastfeeding, it will actually help to stimulate the uterus to contract back down to its regular size. So just kind of a note here with breastfeeding in there. Sometimes people will think that breastfeeding is a form of birth control, and really it's not. So when you're doing milk ejection, then you're going to need to do more milk production. So you're going to have the prolactin release. Well, it will act to somewhat suppress the menstrual cycle in there. It is not going to be considered a reliable way of preventing pregnancy. So a person may not have a menstrual cycle, but it doesn't mean that you can't get pregnant. So a lot of times you look and you go, wow, brother and sister only 9 or 10 months apart. The parents were probably using that as a way of assuming that they wouldn't get pregnant again right away while they were breastfeeding, and sometimes it happens. So just because there is no menstrual cycle doesn't mean that a pregnancy cannot occur. Antidiuretic hormone, or vasopressin. This is going to increase water retention in the kidney. It will also decrease water loss through sweat and increase vasoconstriction. So if you did not produce ADH, your urine volume would increase to about 20 liters a day. Normally, a person is going to produce 1 to 2 liters a day with normal fluid consumption. Alcohol inhibits ADH secretion, so that's why sometimes when people start to consume a little bit of alcohol, it's not unusual to have to go empty the bladder. So your thyroid is going to sit just below the larynx. It has 2 lobes. The follicular cells are going to produce T3 and T4, and then your parafollicular or C cells produce calcitonin to inhibit the osteoclasts. So thyroxine is abbreviated as T4 tetraiodothyroxine. It's got 4 iodines on it, is why it gets that name. It's secreted in greater quantities, and it's the storage form of the hormone. It's slower acting, and it can be converted into T3 by removing iodine. So this is the one that's most commonly replaced. Synthroid or Levoxyl are the medications they use for that. T3 or triiodothyroxine is the active form of the hormone. It's more potent. It only has 3 iodines. It's faster acting and short-lived and made in lower quantities. So liothyronine or Cytomel are ways that this can be replaced. So both T3 and T4 combine with transport proteins. So when looking at thyroid hormones, sometimes you need to look at more than just the level of TSH. The levels of T3 and T4 and what they may be bound to can give some explanation if the person is still struggling with their thyroid hormone replacement. So control of these, the blood thyroid hormone levels, are by a negative feedback loop. So if thyroid hormones are low, it needs to stimulate it to produce more. If they're high, it will tell it to shut down. Calcitonin, this is going to decrease blood calcium levels by inhibiting the osteoclast activity. So a lot of times people assume with thyroid hormone, it's only based on telling you how much you get to eat and how much you have to exercise. It's going to increase the basal metabolic rate. So this influences the speed of chemical reactions throughout the body. So it can cause an effect on a lot of different systems. It's going to increase the use of oxygen to make ATP. It will increase the metabolism of carbohydrates, lipids, and proteins. It increases the synthesis of the sodium-potassium pumps and increases body temperature from ATP use. So when you think about hypothyroid, those people tend to be a little bit cold. Somebody with hyperthyroid tends to be a little bit warm. It's going to stimulate protein synthesis, increase the use of glucose and lipids for ATP, and decrease cholesterol by enhancing secretions. It can enhance the actions of some of the catecholamines, like norepinephrine and epinephrine, making more receptors. It can increase heart rate and blood pressure and increase the forcefulness of the contraction of the heart. It can increase body growth with human growth hormone and insulin, so that's going to be lean body growth. And then it also interacts with serotonin and estrogen. So the parathyroid is 4 small masses that are attached to the thyroid gland, and it produces parathyroid hormone. Its job is to regulate your blood calcium, magnesium, and phosphate, and it does this by increasing osteoclast activity. So it will increase bone breakdown. If the blood calcium is low, you'll decrease the blood bone breakdown, but it's also going to decrease the amount of calcium and magnesium that's lost from the kidney and increase the phosphate loss. And then it will promote the formation of calcitriol. Calcitriol is the active form of vitamin D3, which is needed to increase the absorption of calcium in the gastrointestinal tract. So this hormone is controlled through negative feedback of blood calcium levels. So the pancreas is one of those organs that is going to be both endocrine and non-endocrine. The endocrine portion is the islets of Langerhans. So the alpha cells are going to secrete glucagon. The way I remember it is glucagon is saying the glucose is almost gone, so it will increase blood glucose levels. The beta cells will produce insulin. Insulin is going to decrease blood glucose levels. So what will happen with insulin is it's going to increase the intake of glucose into cells. That's how it lowers it in the bloodstream, is because it puts it in the cells. It's going to increase glycogen synthesis, it increases protein synthesis, and it increases fat storage. So insulin is going to be produced when the blood sugar is increased. So what it's saying to the body is, we've got nutrients here. Let's store things, let's repair things. Glucagon is going to break down glycogen stores in the liver and muscle. It's saying our blood sugar is low. Let's break some stuff down to raise that back up. It's going to increase gluconeogenesis, which is literally the generation of new glucose. It allows you to chemically convert other things into glucose. Protein will be broken down for energy, and fat will be broken down for energy. So sometimes people will try and do diets that will manipulate the levels of insulin and glucagon. It's not that one of them is good and one of them is bad. You want to have proper levels of both of them. If you did not have adequate insulin levels, well, it would not be sending the message for fat stores. It's also not going to be sending the message for protein synthesis, for healing and repair. So having balanced proper levels is the important thing. So the adrenal glands are paired glands that are going to sit on top of the kidneys. They literally mean adrenal for on the kidney. The cortex is the outside portion of it, and it makes up about 85% of it. The mineralocorticoids are going to affect mineral homeostasis. So aldosterone is your main one here. It's controlled by that RAA system, renin-angiotensin-aldosterone. It will increase the absorption of sodium and water in the urine. And then it will increase the secretion of potassium and hydrogen, which will be increased in the blood pH. Glucocorticoids will affect glucose homeostasis. So the primary one is cortisol here. 95% of it is cortisol. You also have cortisone and corticosterone. This will promote protein breakdown, especially in muscle. It promotes gluconeogenesis, making new glucose, lipolysis, the breakdown of fat and triglycerides, resistance to stress by supplying glucose from the liver. So what it's doing here with these is, in a stress response, what it's trying to do is make sure that you have more glucose and more energy available. And it will do that by breaking down whatever it needs to, whether it be fat, whether it be muscle, breaking things down in the liver. It's also going to prioritize what is important to deal with during a stress response, so it will decrease the immune response and inflammation, and it's going to slow wound healing and tissue repair. The stress response is more concerned with the immediate threat. These things here with the immune response and inflammation are more concerned with long-term health, so it will postpone those things. So a lot of times people will think if they get a cortisone shot, oh, it means things have healed. What they are used is to try and decrease the inflammation in something. It does not promote wound healing. That's why they do limit them. But a person getting a cortisone shot needs to be reminded that it does not mean the tissue's healed, that it actually may be more susceptible to re-injury immediately after a cortisone shot. So androgens, they're masculinizing hormones. And it's derived from DHEA, dehydroepiandrosterone. That's actually a precursor to many of the steroid hormones. So that's why stress can actually affect hormones and throw off some of your hormone cycles in there, is everything that comes from DHEA. If you're using all of it to make your stress hormones, you may not have your levels of your other hormones be quite as high as they normally are. So the effects of this in males after puberty are pretty weak because they're going to be producing testosterone from the testes, which is much stronger at masculinizing. In females, it will increase the sex drive. Excesses of it can be converted into estrogen, particularly after menopause. In both males and females, it will lead to the development of axillary and pubic hair. The control of it is not fully understood. It is stimulated by adrenocorticotropin hormone, so stress can affect levels of this. When we say increased sex drive, increasing the levels of this is not really a way to increase a female's sex drive. It will actually do more masculinizing of her body, which is likely not going to be the desired effect. The adrenal medulla, this is going to be the inside of it. It's going to secrete epinephrine and norepinephrine. This will help to enhance the stress response or augment fight or flight. So what it's going to do is increase blood glucose and fatty acids so that you've got more energy to deal with the stress. So gonads, they produce gametes, which are your ovaries and testes. In the ovaries, you have estrogen, which is the female sex hormone. This is the one that primarily regulates the menstrual cycle. Progesterone, this is the one that's going to come through halfway in the cycle. It's going to maintain the pregnancy and endometrium. If there is no egg that goes in there and a fertilization, the levels of it will drop, and that's when you have the menstrual cycle. Relaxin is going to increase the flexibility of the joints, particularly the pubic symphysis. Levels of this are much higher towards the end of pregnancy to allow the body to adapt and the hips to change their shape for childbirth. So inhibin will suppress FSH after ovulation. The idea here is to only have one egg be ovulated at a time, since really the uterus is designed to deal with one, not multiple eggs. So the testes produce testosterone, the male sex hormone. Again, negative feedback loop here. Inhibin suppresses FSH to decrease sperm production. So if the sperm aren't leaving, it can shut down the production in there. The pineal gland, this is that one that produces melatonin that we talk about in the nervous system. That's going to help influence the biological clock. Light inhibits production, so that allows more of a waking feeling. Dark allows production, which will make you feel sleepy. So with the stress response, a stressor is any change in the environment. It can be pleasant or unpleasant, physical or emotional. If somebody drops $5 million on your doorstep, it would actually be a stressor. So initially, you're going to have the fight or flight response. This is sympathetic nerve initiated and is short-lived, but this is going to get the response started very quickly. So if the stressor doesn't go away, then we move into the lowered resistance phase, which is hypothalamus initiated, and this can be longer lasting. How long it lasts depends on the intensity of the stress. So sometimes these systems do start to shut down if the stress continues on. Sometimes the body just cannot sustain these responses. Hopefully the stress goes away and then these systems can shut down and return back to normal. So corticotropin releasing hormone is going to stimulate the anterior pituitary to produce ACTH, which will lead to cortisol production. The idea here is to have more glucose available from the body, from the storage of fat and lean tissue, more glucose available to deal with the stress. Growth hormone releasing hormone from the anterior pituitary stimulates human growth hormone and the liver to produce the insulin-like growth factors. Again, the goal, making more glucose available. Thyrotropin releasing hormone, it's going to stimulate the anterior pituitary to produce TSH and the production of T4 and T3. Again, the goal here is the increased use of glucose for metabolism and energy. So exhaustion occurs when the body is depleted. It can no longer sustain its resources. There are several diseases that are associated with this. We see muscle wasting, immune suppression, ulcers, beta cell failure in the pancreas. That can lead to diabetes, increase in stress-related diseases, worsening of chronic conditions, gastritis, colitis, irritable bowel, hypertension, asthma, rheumatoid arthritis, migraines, anxiety, premature death, fibromyalgia, chronic fatigue, depression. This is not an exhaustive list. You could probably argue just about any disease is made worse with stress. So there's a couple other diagrams here in the notes, a few other endocrine tissues in here that we talk about a little bit in here. They're the HCG, this is increased production of progesterone and estrogen. This is going to help to maintain the pregnancy. HCG is actually what's measured in pregnancy tests. So with most of these, we do talk about them in other systems. The other ones are just in here for your own personal interest. Look at them if you're interested, ignore them if you're not.